Question is that this bill be now agreed to in principle. I call the Premier.
Thank you, Mr. Speaker. Mr. Speaker, I rise in support of the bill. The Medically Supervised Injecting Centre was a groundbreaking service that followed the recommendations of the 1999 Drug Summit. And now, after 9 years of trials, we're moving to formalise this service and make it part of our regular health services. And why? Because it has saved lives. Because it's reduced disease risk. It has reduced the incidence of public. It has brought people who live on the margins, who live on the edge, into contact with health services and drug treatment services. Now, this service was controversial when it was first introduced. It still remains the subject of some discussion in the community, but it's now become accepted by the medical profession as necessary and something that should be permanent. What I've asked people of the community, and what I ask of members of this House to do, is to judge the King's Cross Medically Supervised Injecting Centre on its results. After 9 years of operation, we've seen significant positive benefits come as a result of this service. A recent independent evaluation by KPMG found that the Medically Supervised Injecting Centre has successfully managed more than 3,400 overdose-related events. A recent independent evaluation by the KPMG found that the Medically Supervised Injecting Centre has successfully managed more than 3,400 overdose-related events. It has helped more than 12,000 injecting drug users, referred more than 8,500 drug users to services, and 3,800 of those to drug treatment. It's also distributed more than 300,000 clean needles and syringes to users and helped reduce the proportion of local residents who report seeing public injections from 55% in 2000 to 27% in 2010. Now, a recent release from the Bureau of Crime Statistics shows that the Medically Supervised Injecting Centre has not had a negative impact on robbery, property crime, or drug offences in the King's Cross Local Area Command. What this centre has done is to save lives. It has reached out to people who would otherwise not access medical services, who would not otherwise access drug treatment services. It has brought them into contact with those services. It's assisted people to put their lives back in order. Now, formalising this service provides certainty. It provides certainty to the vulnerable victims of drug addiction. It provides certainty to the local community who've seen a positive benefit to their surrounding area as a result of the Medically Supervised Injecting Centre. It provides certainty to families who are struggling with drug addiction. And let's remember, for every person who visits a Medically Supervised Injecting Centre, there's a mum or a dad, brothers and sisters, partners and children, who themselves are suffering because their family member suffers from this addiction. If we can assist drug-addicted people to get their lives back in order, if we can assist them to get off drugs, we can assist that whole family and the people around the person who's using heroin. Now, this legislation makes clear and continues our guarantee that this will remain the only legalised injection centre in this state. It does not, as some people have irresponsibly suggested, create any precedent for the state. The legislation also makes clear that the Director General of Health and the Police Commissioner retain the right to revoke the licence of this service should it ever be deemed necessary. Now, as I've said, in an ideal world, we wouldn't need a service like this. In an ideal world, we wouldn't have to provide this sort of outreach. But we live within the real world. And what we know in the real world is that people do struggle with drug addiction. People who live on the margins in particular need a different service, a different form of outreach. Now, that's why the Medically Supervised Injecting Centre was established, and that's what it has provided. It has had now 9 years of trial and evaluation. 9 years of trial and evaluation, and the results are clear. Now is the time for us as a Parliament, as a community, to recognise those results, to make this helpful and highly effective service a part of our health system. Mr. Speaker, I commend the bill to the House.